I'm Dr. Jolly Thomson. I focus on clinically supported lifestyle correction for treating chronic lifestyle diseases. Here I would like to share my professional experience with this approach. This series is about my experience with patients who took clinically supported lifestyle correction to avoid surgery and reduce and stop medication. This can help you understand how valuable are the lifestyle corrections needed for overcoming any chronic lifestyle disease. Most importantly, what advantages such an approach has when deciding on surgical procedures or continuing with lifelong medication. Here we learn of the approach for a patient, 33-year-old lady suffering from depression, irritability, etc., diagnosed as bipolar disorder. On medication for the last 2 years, she is not able to reduce medicine. And she's continuing with the low mood, lack of motivation, mood swings, anxiety, and discontinued her studies. Actually, she was doing a postgraduate course actually. And she's suffering from obesity also. Actually, when the disease started itself, she was slightly in the obese stage. And now again she had regained around 10 to 12 kg weight also. And she's married and having a 6-year-old child, and they are separated now. So family problems, and her need is he want to come out of medication and to be more active, and she want to restart her studies also, complete her course also. When we starting this clinically supported lifestyle correction, she was taking 9 tablets a day and 5 different antipsychotic medicines. Here I will try to explain how the surgery could be avoided, how long it took for multiple medicines to be reduced and stopped, how long it took to get relief from symptoms, and progress evaluation based on corresponding improvements in periodic tests. When we come to the details of the patient, this is a 33-year-old lady. Her height is 167 centimeters. And weight is 80.4 kg. She's obese. And she's only 33, but her body age is 53. So accelerated body aging is the 20 years acceleration of the age. So that means she can get a disease of a 53-year-old person's. The diseases can occur. And her abdominal circumference is 97 centimeters. That is abdominal obesity is there. And fat percentage is almost 36.9%, that is almost 37%. She should be ideally only to less than 25. 20 to 25 will be ideal for a lady. Depression, it was started as depression, but she's having anxiety, stress, irritability, and even self-harming tendency. And it is diagnosed as according to the psychiatrist, diagnosed as bipolar disease. And there is obesity also. And when the disease category comes, it is psychiatric disorder, and metabolic syndrome also is there. When we come to the symptoms, her mood swings is there, lack of motivation, don't feel like doing anything, always sleepy. And it is mainly because of the medication also. Actually, all the medications which is taken for this psychiatric medications are usually suppressant. It is dulling your brain. That is the reason she is not sleepy. And on the same time, anxiety is there. Even sometimes suicidal ideation is coming. That is also, when you look into the details of the side effect of any psychiatric medicine, there will be suicidal ideation will be a side effect. So, because it is acting, all the medications is acting on the brain, chemical, that is, usually the neurotransmitters are there. Actually, the message transfer is with so many chemicals is involved, that is called neurotransmitters. Actually, almost all the medicines is either stimulating or suppressing one of the neurotransmitter. Or we don't know, really, we don't know, even for the modern medicine, we don't know how it is acting actually. So we get some benefits, so that is approved and taking the medicine. And when there is 4 or 5 medicines acting, taking, it is interacting also. So we don't know how it will be acting and interacting. That is the problem actually with the psychiatric medicine. And Also, after starting with the medication, she is less active and appetite is increased. That is another. Many of the psychiatric medicines will increase, having a tendency for weight gain, because may make the person less active, and also the appetite will be there, because the appetite center and all is there. No, the brain is controlling your eating habits and all. So naturally, the appetite will be more and less active. That weight gain will be there. Next is when we come to the details of her medication. She's taking Lames, that is lamotrigine 50 milligram, 2 tablets twice. And also Thomson, that is lithium carbonate, that is also 1 morning and 2 evening, very high dose actually. And lonazepam, that is mainly for the sleeping, and that also is a suppressant, that is 1 tablet. And desferin, that is a Desferin vaccine. So all medical names are so difficult to pronounce itself. That is also 1 tablet. And Olans, that is olanzapine. So there are 5 tablets here, 9 tablets, but 5 type of medicines is there. And when we look into the blood test, and we take a detailed blood test and really the relevant things I am telling. And the inflammatory markers are very high. ESR is high, HSCRP is high, CRP is high. And the blood count also is totally in the abnormal. Even the platelet and is high. WBC is high, platelet is high. That means there is an inflammatory reaction is going on. What the body is, that our immune system is reacting to, they are in a very defensive mode anyway. That is what is this shows. And her vitamin D level is very low, 14 only. And potassium level is high. I don't know why the potassium level is high. Maybe because of the medicine interaction or something like that. And she is having TSH is high. That means there is a thyroid hormone production is slightly, that brain is stimulating, giving. So maybe an autoimmune disease starting for that also. Then urine leukocytes, that is infection is there, like infection, but she is not symptomatic. And also with the scanning, she is having fatty liver, grade 1, and some uterine fibromyalgia is there. That is not that significance. And when we come to the body parameters, her weight is 80.4 and BMI is 28.8. Ideally, Indian should be having only less than 23. And preferably, it is always when the psychiatric patient, the BMI should be on the lowest normal. By 18 or 19 will be the ideal. And the abdominal circumference is 97. That is very abdominal obesity is there. And the body age is 53 and fat percentage is 36.9. Then when we start the clinically supported lifestyle correction, what we are trying to do is correcting the body parameters. So her whatever be, it's an inflammatory reaction. The body is in an inflammatory mode. That is why all the parameters in the inflammatory markers also is high. So when the brain is inflamed, when you get the skin, it is inflamed, you get the pain, or the joint, it is pain. You will understand that. But for the brain, if it is inflamed, if the outer part is, that is the brain meninges and the coverings are inflamed, you will get the headache. But the internal part, it is not sensitive to pain. But the internal part is this thing, it will appear as a psychiatric disorder actually. So basically, it is an psychiatric disorder. It's inflammation of the brain, and also the derailment. It is in the chemical mechanisms in the brain. So with the lifestyle modification, what we are trying to do, actually, we are finding what is creating the problem. And with for this sort of patients also, we do the allergic studies also. So any food is reacting to her, or any food or inhalant or anything is reacting, making her system get agitated. So for her, so many food items like vinegar, it's a very rare, usually we don't see that. Mushroom, tomato, yeast, vinegar, aniseed, eggs, so many items are allergic for her. And also the dust, paper dust, perfume, dog dander, house dust mite. So, and also other things like amaranth, yeast, that is yeast is usually used for the baking and making appam. Our Kerala diet, it is appam is so delicacy for us. So it is most of the home, it's a daily food. So that also need yeast. So egg, so many items. I'm not going into the details of the food because it is individualized and it is different for each person. And so that is the food aspect. And what we are in the clinically supported lifestyle correction, we will try to avoid all this food which is reacting to making an immune response to the body. And she needs a weight, so based on she needs weight reduction. So because the omega-6 fat, when the fat is excess, the overweight means the fat is excess. Fat excess means there will be, in our food the omega-6 is very high. So I had to burn out this omega-6, then only the inflammation can be controlled. So low calorie diet. So we try to reduce the calorie content of the food to around 650 calories. So that with some exercises you can reduce initial stage 2-3 kg weight reduction can be achieved. We are actually, for the patients, ideally in the first week, the first month itself around 10% reduction. And on an average, we are, for an ideal patient, we will be able to, for obese patients, those who need weight reduction or the fat reduction, you can reduce the body weight around 20%, you can be able to reduce in 3 months. And after that, the slight reduction, because the initial result you won't get for the next 3 months. And anyway, and also avoid all the intolerant food and also color preservatives, etc. Because color preservatives, tastemakers, all act as a toxin for the body and they all make the immune system irritated. So the problem is with the immune system. So what we are trying to give a rest to the immune system actually, and not only reducing the fat and also give a high amount of omega-3, that is anti-inflammatory, that will help the patients to regain the balance of omega-3 and 6, the balance of inflammation and anti-inflammation. So that is should be in the 1:1 ratio. So we are increasing the omega-3 and try to reduce the omega-6 fat. So what was her result was actually, when the 8th day itself, she is almost all the symptoms she is having a reduction. Or 50%, they are telling around 50% reduction is there for the most of the symptoms actually. And by the 15th day, it was around 60% reduction. And by day 30, almost around 80%. And by 60, she is symptom free. She is comfortable. Next is how fast we are able to reduce the medication. Actually, we tried to reduce one by one. Initially, first was reduced, this Olans was made into alternate day and stopped. By the 15th day, Olans was not there. By 30th day, before it was over. And along with that, this Desavan also, as we were able to get rid of that also by the 60th day. By 48 days itself, it was over. And the other Lonazep, actually, we continued till this 30th day. And by 60th day, there was only 2 medicines actually. That was the highest dose. This lamotrigine was 2 tablets morning and evening she was taking. And Lithosan, she was taking 3 tablets, that is 1 morning and 2 evening. That actually, Lithosan reduced from the 15th day onwards, we started reducing Lithosan also. 1 morning and 1 evening made it to do. Then reducing the psychiatric medicine should be very carefully, very slowly only. Because one by one, we cannot say, because there will be an addiction also, just like alcohol, we cannot withdraw it if there will be withdrawal symptoms, just like, or the other thing, anything which is affecting the brain, there can be dependence on it. So we had to be very careful in reducing, slowly only we can reduce, and see whether the patient is having any aggression or any discomfort. Then take the dose the same, don't wait for some more time to reduce. So she was actually able to come out of the 3 medicines which were used in the low level by the 60th day. 30th day also she was taking, but and about the other 2 which is on heavy dose, that is lamotrigine and the lithium. Lamotrigine, actually we tried to reduce the lamotrigine early, but she was finding it uncomfortable with reducing this lamotrigine. So we decided not to reduce the lamotrigine unless the other things are over. Dithosan, we are from the 15th day onwards started reducing, and by 30th day we are by 60th day it was initially 3 tablets and then it was 1 tablet only, and when the patient came by the 90th day there was only lamotrigine was there. And lamotrigine she was taking initially 2 tablet morning and 2 tablet evening. We started reducing it only by the 30th day, and 1 morning and 2 evening, and then 1 morning, and by 60th day she was taking only 1 morning and 1 evening, and then it is 1 morning and then evening half, and then by 120 day she was totally out of medicine, and the mother she was accompanied with always her mother, and both of them were so happy that she's both by 90 days it's every day they were happy because every day medicine is reducing and her mood and everything is getting correct. By 120 days she was actually reunited with her husband and they're very happy and planning to restart her education also. But we should see the changes in her blood level also. Her inflammatory parameters also, the CSR came by 15th days 25 and 60 days it is 20. It's almost normal. HCRP gradually came down by 60 days is normal. Blood count are also very fast reduction. But initially the blood count was 12.7, reduced to 10.6, and by 30th day itself all the blood parameters, the blood count, CBC parameters have come down to normal. Vitamin D was corrected by 30th day. And this potassium was high, that was corrected in the 8th day itself. And her TSH level was high, but in the 15th day itself, TFT, that is thyroid function test, was normal. And she had initially the subclinical urinary infection was there. By 15th day, it was also over without any antibiotic. Usually, we had to give antibiotic for this problems. But the immune system, we are actually in the clinically supported lifestyle correction, what we are trying to do is to strengthen the immune system. So if the immune system is strengthened, these infections and all, the immune system can take care of it. That is what it shows. And then when we come to the body parameters changes, that is the most important. Actually, we are trying to change the body parameters itself, really in the macro level and in the micro level. Micro level we cannot assess it, but in the macro level we can clearly assess it. And when we started, her weight was 80.4. And by 30 days she came down to 75, and by 90 days 71.8, and day 120 it is 16. Actually her weight reduction is not ideal, so you should be able to get a weight reduction of around 20% in 90 days, but she was not able to achieve even by 120 days. That is mainly because the initial stage she is on so much of medication. The drive to do the exercise and all will be very low. But even though she is able to reduce to below 70, above 80, almost 12 kg in 120 days. But other type of patients usually have much more weight reduction. That is because she is on medication actually. By now it is all the medicines are over, I think she will be able to reduce it faster. That burning out this fat is very important for maintaining the mental status actually, especially for psychiatric patients. So her BMI was 28.8 and now it has come down to 4.8, but what we are aiming is less than 21. And the body weight we are aiming is actually around 55 and the BMI around 21, or if possible even lower than that. Then her abdominal circumference was initially 97 and it came down to 83 by 120 days. And what we are ideal for her figure, or she's a very tall girl and lady, and really beauty. Actually, she was initially when she came, she was with a bigger tummy, and on the 120 days when they came, they themselves were saying, mother was telling why she is at home, because in Kerala, when after marriage the girl comes to stay in the home, it is mainly for the pregnancy, and with the big tummy everyone was asking whether the second pregnancy is there. They are telling now the tummy is reduced around is to 83 centimeters, but ideal for her is around 65, at least below 70. That is, we are expecting to reach actually. And the body age, she was 33 year, but 53 year was her body age. But by 120 days, it came down to 45. But he has to reduce, he has to, now also she is obese and excess fat is there. That is the reason for that. When what we are aiming is to reduce below, it will be possible for if she stick to this protocol, she can reduce her body age below the calendar age. Now 33 years, but she can come down to below 30 actually. So that means that figure also, that the body shape and her beauty, everything will be improved. Because everything depends on the skin health and the body figure. So what we are trying to improve also is that, and also everyone will be worried whether the skin will be and the skin health and the weight reduction is there. So in this clinically supported lifestyle curriculum, what we are giving is a special oil which is for the skin health also. So it is very high in omega-3 and 6 and 9 and some vitamins for the skin. And when it is applied in the correct format, it's actually the skin will become brighter. This color will be again because it is applied as a sunscreen also. It's a nutrient. It's not a commonly used is not sunscreen. It has a nature itself to reflect the most probably I think ultraviolet rays is reflected also. I don't know. Anyway, the patients will get better color. And maybe because it is when we are exposing, we are advising the patients to take this thing, apply on the skin and take morning and evening at least half an hour sunbath also. So it is actually not tanning. It will not take any tanning on the, if we are applying it in the proper way. It won't tan, the skin actually become brighter. And also the skin, even the old people who are 45, 60, 65, and their skin wrinkling will be reduced also. So that way also that the skin elasticity and all regained. So even the wrinkled skin can get much better. And if some people having, and even this girl having this darkening of the face, and because of the obesity, there will be hyperinsulinemia. So the darkening of the skin is common for this, especially for the psychiatric patients and obese patients. So that also was taken care of by applying this body care application actually. That is also based on nutrients only. When we consider what is the benefit of this clinical, lifestyle modulation for this sort of patients, actually she's able to come out of all the so much of medicine, so much. This 5 antipsychotic medicine that is also very high dose. It's too much for a person. They won't be able to think properly actually with that much of medicine. She's able to come out of all the medicines in the 120 days, 4 months only, and reduce her obesity also has come down anyway, but she has to come down another 14-15 kg also. Then only she'll be in that will be safer for her. Even there are so many food is intolerant also. So if she if she don't come down to her excess fat and the ideal body composition, if she don't achieve, there is always a tendency to weight gain, because we are always, the food is all around so tasty. So and in Kerala there are so many festivals, because we are all the major religions are all here. Christian celebration, Hindu celebration, Muslim celebration. So every month there will be 1 or 2 celebration, and also we are very keen on going for attending all the functions like a wedding and also the baptism and so many functions. So will be everywhere the food is served and the delicious food is served, so the temptation will be there. So when you are more fat, more tempted, more interested in food, when you come down, when you bring down your BMI, then your interest to food will be reduced. So it will be easy for you to maintain your body and out of sickness also. So whatever, after you are accumulating all the fat and the other toxins in your body, and that is creating all the lifestyle disease. Lifestyle disease comes in the later part of the life. Now it is for the children also, lifestyle disease come, because that is because of the excess toxin exposure and all. So what we have to understand is the psychiatric patient, the good message, I want to convey the message that even those who are taking such a huge amount of medicine can come out of medication. If you get a proper yourself, you should be willing, and also from the family support. This girl was getting total family support and she's staying throughout the time with her parents, and only after the treatment, I had told that to go to husband's place and all, only after coming to this ideal, at least she come below 60 kg, because otherwise she may not be able to manage herself there. Here, in clinically supervised and supported lifestyle correction, what we are trying to do is use the healing power of the body by empowering the healing aspect, the anti-inflammatory aspect of the immune system. First is by providing optimal nutrition. Second, by promoting removal of toxins by improving circulation through optimal stimulation of all cells by planned exercise. Third, minimizing toxins entering the body through food, water, air, and cosmetics. Diabetes, hypertension, heart disease, liver disease, kidney disease, obesity, stroke, allergies, autoimmune diseases, and cancer come under the umbrella of lifestyle diseases. 90% of the medications and 90% of the surgeries are for lifestyle diseases. This means that 90% of the medicines and 90% of the surgeries can be avoided. In the case of any lifestyle disease, the best treatment begins with the first step of diagnosing the underlying fault in lifestyle that is the cause of the disease. Next is corrective measures to rectify the damage and overcome both the disease and the need for continued medications and surgical interventions. It is good to understand that neither medicines nor surgery can cure a lifestyle disease. To put it differently, it is not a lack of medication or surgery that created the disease in the first place. This is why once medication is started, it becomes a partner of the disease for life. Very often, both the disease and medicines will keep on adding more numbers along with the unwanted side effects, with no hope to return to a healthy status, which not only affects the patient but also the dependents and caretakers. This is why it is very important for you to understand and correct lifestyle while also encouraging others to do so. Another important aspect is when someone is talking about healthcare and treatment approaches, you should consider the scientific background of the concerned person. I am Dr. Jolly Thomson, started medical education in Government Medical College, Kochi as 1981 batch and completed Diploma and MD in Obstetrics and Gynecology from Government Medical College, Thiruvananthapuram, Kerala, India in 1992. After additional training in reproductive medicine, surgery and painless labor, I joined government service. Later, I resigned from government service and in 1997 started practicing as consultant at Life Care Centre, Devara, Kochi. I focus on lifestyle modulation with the clinical support for lifestyle diseases, minimizing need for medication and surgery. We believe the informed patient is the key to treatment success. You can find detailed content on different diseases, their treatments with emphasis to the benefits of lifestyle correction from website and YouTube playlists. The videos are prepared to understand more about the disease, the possible underlying cause, early diagnosis by understanding symptoms, current diagnostic methods and treatments along with the benefits and side effects, practical aspect of lifestyle self-correction and for those who may require clinically supported and supervised lifestyle correction. When a patient is having more than one disease and there are too many diagnostic and treatment modalities with many side effects, awareness of the benefits and problems of different diagnostic, medical and surgical interventions is the key to regain your health. Better informed patients take better decisions and live longer, healthier, happier lives. I would like to bring to your attention how the major part of the medications we take are excreted in urine, sweat and stool. It will reach the groundwater, rivers, drinking water, plants, animals and food products. That means the medication we take is becoming a threat not only to us humans but to all the life forms on our planet. Therefore, it is essential to correct lifestyle, reverse lifestyle diseases and come out of medications. To protect your children, grandchildren and the coming generations from the ill effect of toxic pharmaceutical pollution, we should come out of the dependence on medication. The current norm of chronic patients on lifelong medication has to change. Spreading awareness on optimizing and minimizing medication is the need of the hour. Thank you.